I'd like to welcome our first guest on the program. We're excited to have our affiliate member and CEO, founder of HealthExpense, Vineet Gulati, on the program. Vineet, welcome.
Thank you, Doug.
Hey, good to have you here. Nice to talk to you. Give our audience a little background around HealthExpense, and then we'll kind of jump in here, talk about the consumerization of healthcare payments and other key developments, challenges, and opportunities that you see.
Sure. HealthExpense was started about 4+ years back, and my background personally before HealthExpense has been over 20 years in healthcare and pharmaceuticals, 10 of which was with a company called Capgemini, where I ran their pharma and healthcare consulting practice, and then worked with the FDA on some key regulatory initiatives before starting HealthExpense. And really the company focuses on providing a reimbursement and payment platform. It's an enterprise solution that helps our clients and partners who are TPAs, third-party administrators, banks, financial institutions, or custodians of health savings accounts, really help improve their member experience around tracking of healthcare expenses and payments as well.
So Vineet, with your experience, what was the problem that you saw that was the driver for creating HealthExpense?
Absolutely. I think when we first started out, we identified that our first set of clients who were our partners, as we would call, were TPAs, smaller TPAs, who were dealing with health reimbursement accounts and administration of those plans as well. And what we found that in order to stay compliant, in order to pay providers or reimburse members, they really needed access to patient claims data. And the members are dealing with an inordinate amount of complexity in that information. As a participant in any one of these high deductible plans with a health savings account or a flex account, you're dealing with a lot of complexity that you have not dealt with before. You have to not only manage the financial obligation of contributing and withdrawing from those accounts, but also understand what your claim's all about. The explanation of benefit is never an easy document to decipher. So what HealthExpense really started to do in a small way in the early days was to solve a problem that both the participant or the account holder had as well as the TPA had. And we did it in a slightly innovative way at that time, which we've scaled significantly since then, was to get the consumer acceptance and use the consumer acceptance to aggregate both historical and current claims data on the member's behalf directly from the health insurance carriers. By doing that and providing that data, we were able to solve the immediate substantiation problem that they had around spend, increase the compliance, and create efficiency. And that problem really is now become one of the most critical aspects in terms of the consumerization of healthcare. We see that same problem in terms of tracking and paying for healthcare expenses as a critical component of all new benefit plans, which are mostly driven by the rise in health savings accounts and high deductible plans as well.
Mm-hmm. So you solved a problem for the TPA, their employer clients, and then the employee consumers. How are the employee consumers embracing this solution?
They love it. The significant benefit that I would have as a consumer or as a patient is that I have visibility into my healthcare spend. I understand specifically how much I have spent, what my copays or deductibles are, not just for my medical account, but for my medical, dental, vision. We aggregate all of the spend in a single place. We make bill payment easier by making it electronic. As you're aware, most of the payments now are after you visited the doctor's office. There's a patient obligation. And we help make sure that you are able to save through targeted secure messaging, through simplifying the actual payment obligation so that you can save in your health savings account. There will be a significant shortfall post-retirement for an average American consumer in terms of dealing with healthcare expenses. So it becomes a critical component of that experience to be able to not only provide convenience, but also provide simplification, a great consumer experience, and also a savings potential in there as well.
Vineet, you're moving a lot of valuable data around, and I mean, we know what comes out in the public press about security issues. How are you, handling and dealing with security for your clients?
That's a great question. So we've architected the solution from day one with security in mind. My own personal background with compliance and working with regulators, and also the team came from healthcare as well. So we go through a voluntary external HIPAA audit on an annual basis. We're HIPAA certified. We also have our partners who are very, very risk conscious, security conscious, both strategic partners, our clients who are financial institutions, regularly audit both our processes, procedures, and data and systems penetration testing as well. So we employ bank-level encryption on data as it moves through to partners, as it moves in our systems, and at rest as well. So we're very, very focused on security because in today's environment, a single data breach can cause significant pain, not just for the individual member, but also for the organizations and partners that rely on us as well.
That's very important. Well, we can't talk about, any of us can't talk about anything in this space without addressing private exchange and the disruption that private exchanges, I think in a very positive way, are going to cause in this marketplace. What do you see out there, as the expectation exception of private exchanges, and talk about your connectivity within exchanges, what your role will be?
Sure. So what we see is that a lot of our large and mid-sized employer clients are really moving away from the traditional model of delivering healthcare benefits to really what we would see as full replacement, moving members across to higher deductible plans to health savings accounts. And where HealthExpense really focuses and really provides value to them is post-benefit selection. That same consumer, that same patient is really now burdened with a significant level of information, significant level of complexity. So the underlying trend is really a very rapid shift towards not just creating an experience where members can select the best benefit plan and reduce their initial cost, but also to continue to make sure that they're using their benefit plans appropriately, that they're saving enough dollars for future expenses, that they're simplifying and removing requests for receipts and requests for documentation. That's a significant benefit in terms of the efficiency that we are able to create as well. And I think that's really a central component of the solution and the benefits that we're able to provide through the network of partners, clients, and their individual members and consumers as well. So our expectation is that we are rapid growth in that market, and that growth will further create avenues and opportunities for us as an organization, but more importantly for our clients and partners who are, again, enterprises themselves, TPAs and banks as well.
Yeah, I think to your point, too, in the growth in the marketplace is that we all kind of sometimes get a little too linear focused on private exchanges, and rightfully so. They're going to explode, and they're projected to have 40 million plan participants by 2018. But sitting outside of exchanges, the other 120 million employee-sponsored plan participants are rapidly moving, to your point, to full replacement programs. So HSAs are expanding across the spectrum of employer-sponsored healthcare.
Absolutely, and that's a trend that's really now becoming part of the national dialogue about healthcare. It's a trend that's not just based on regulation. There's an underlying economic shift from moving away from employers really being responsible for every nuance and aspect of healthcare benefits to really moving that shift to consumers, to the individual patient, to the participant as well. And that's really a trend that HealthExpense is really aiming for and supporting. We've created and architected our solution over the last few years based on what our partners need, what our clients need, and we keep really our big focus always is to make sure that we're solving their problems first and doing it in a manner that allows them to scale and to support their members on a day-to-day basis as well. And that's really that's a wider problem than just the private exchanges. It affects the industry in general. So.
And that's a pretty important message for the influencers as well, who I talk about as the employers. The employers need to hear about what you're doing because they're direct influencers back to their TPAs and banks and health plans, correct?
And that's correct, absolutely.
You know, we all talk, Vineet, about engagement, which is critically important. And I'd like to know your thoughts on that. And then what role HealthExpense plays around engagement?
Absolutely, and I think the way we measure engagement is really in two places. Given the core capabilities of the solution and the way we affect the consumer experience, a big part of that engagement happens up front where you're able to dialogue, and it's not just about technology. We focus a lot on technology being a technology platform to make it efficient. But a big part of the enrollment that happens, a big part of the communication and messaging that we're able to work with our partners and employers is to really illustrate and explain the benefits of engaging with a technology solution, really supporting them through one-to-one secure messaging, making sure that they have a trusted counterpart is a key part of that experience. So when we look at engagement, what we're really trying to do is not have a member come to our solution on a day-to-day basis. Of course, we want it to be an indispensable component of their healthcare benefits management, but we really measure engagement in terms of how many specific instances of value we're able to create, how many points of substantiation we're able to increase for them and for the TPA partner or bank, or how many times they come and make payments and how simple that process can be as well. So from our standpoint, engagement is really a continuous process, but it's really evidenced by an average consumer or participant using our solution perhaps maybe 10, 15 times in a given benefit period if they have low healthcare benefit usage. And that's really the area where we want to make sure that their engagement with these technology platforms is simple, is efficient, and brings them immediate value as well.
Very good. Vineet, where do you see the health payment market going over the next 1 to 2 years? What are the trends that you're looking right at? What do you see?
I think the market size, as we've seen in terms of the industry metrics, is very, very significant. It's over $300 billion in essentially payment volume, and it will continue to grow. Where we see the biggest pain points is still with the providers, with the physicians, the hospitals, where they're still challenged with receiving consumer payments. Making that efficient, making that visible, and more certain in terms of inbound volume is really a key part of that, the reimbursement and payment market as well. And we expect that growth to continue. Pardon me. And we expect that growth to really result in a fair amount of shift in terms of what kind of benefit plans are offered, how incentives can be driven for payments that can be made earlier, or how the member experience can be changed either at the provider's office. So the automation and changes will continue on, and we'll continue to see the growth as well. And really from a standpoint of our immediate clients and partners, a big shift for the custodians and administrators of health savings accounts is to really make sure that they are able to create a class of savers, people who can save the maximum amounts in their health savings account and utilize that money as a key cornerstone of their retirement strategy or post-retirement healthcare expenses as well.
Vineet, time flies and we're having fun, and this has been a very informative discussion, and I sincerely appreciate you spending the time. I want to give you a minute or so to leave our audience with a couple takeaways, if you would, please.
Sure, absolutely. I think we've spoken a lot about reimbursements and payments, and as a company, we're really, really focused on that, laser focused on supporting our clients and partners. We have over $1 billion in claims value captured to date. We have strategic partners that cover a very, very major part of the industry in terms of consumer-driven healthcare. We know that the problem is significant, and really focusing on the consumer and making sure that that experience is frictionless, that we support our partners and clients is really our core focus. And those are the two things that as a company we will continue to strive for and to support both our immediate enterprise partner and really make the experience simple for the consumer as well. And it's a pleasure to have been here with you this morning as well. So.
Yeah, thank you so much. And I want to remind our audience, too, that we said at the beginning of the program, you can join Vineet and his team at IHC Forum and Expo in Atlanta soon, June 23rd to 25th. You can also find information about, HealthExpense on our website. They are an affiliate member. Vineet, have a great weekend, and I'll see you soon in Atlanta.
Thanks, everybody. Bye-bye.